Let's get into kind of that Medicare Advantage.
Yeah. So what we talked about earlier with this, you've got Medicare Part A, Part B, this Medicare supplement, and then you've got your prescription drug coverage. What Medicare Advantage does is it actually says you don't have to do any of those things. You're going to have one place to go through United Healthcare, let's say, and it's going to be set up like a PPO. So you have to go, or an HMO rather, where you have to go to the doctors that are part of their network. All of the money that would come from Social Security goes to them. And so now you're joining that Medicare Advantage program that's inside of this HMO, and you have to follow the rules of the HMO. Now, the benefits there's some that are really nice. Like we had a client of ours that lived a little more rural, and for him, when he scheduled an appointment with the doctor came to his house.
Oh, wow.
Because that was part of his Medicare Advantage program.
Okay.
Because he lived in a rural area and that kind of stuff. So that was pretty cool. The downside is if you don't have the doctor in the network, or if you move, that's a huge one. If people relocate and they're now in, a different state, there might be no network there. And so there's a lot of risk. Some people like it when it works, but there's also quite a bit of risk in going that route versus traditional Medicare.
So can you switch? Like, is it kind of the same thing as insurance where you have to have like a major life milestone to switch, or is it at the end of the year? Or
yeah. So what's hard with that is once you're into Medicare Advantage, you can switch, but you have to go through underwriting, and so you can't. The insurance company could say we're not taking you anymore. What happens with Medicare is when you turn 65. You have this window where you're guaranteed to get coverage. It's a 6-month window. No matter what your health condition is, you're guaranteed to get your Medicare supplement insurance. Now, to be clear with that, a lot of times people have some confusion and say, hey, I'm 65, but I'm still working. Do I have to get my Medicare supplement? It's 6 months after your 65th birthday or after you stop working.
Okay.
Whichever one is later.
Okay. So even though it's called Medicare Advantage, it's not.
It can be an advantage, but it's not. Yeah, that's right.
That kind of is some good marketing.
Yeah, exactly. Yeah. It's a bit of a misnomer.
Yeah. It sounds like you can like skip the line.
Yeah.
It's like a fast pass.
My fast pass. Yeah. Which we'll get. That's a whole different episode because if you're buying fast passes, you're going broke and you can't.
Yeah, and I don't know that you want a fast pass when you're talking like.
Yeah, true enough. Yeah.
Near the end of your life, I don't think you want a fast pass.
No, yeah.
Like, can I have the slow pass?
Yeah. Whoops.
Okay, so another question that we kind of wanted to cover is talking about some of the big health type expenses people have that they aren't used to with Medicare.
Yeah, and so what's kind of crazy with that is, so first, a lot of times people will think, I want to get all my health stuff done before I retire because I don't know what Medicare is going to cover or not cover. What we find is that for the most part, when somebody has a decent Medicare supplement policy, Medicare Part A and Part B, usually there is $0 out of pocket for procedures, which is pretty cool compared to when I was working and I've got deductibles to make and all that kind of stuff. But what many times people don't think about is they no longer have dental coverage. And so
that can be a big one when you get a little older.
Well, yeah, especially when you have to start having crowns or, major work. I mean, it's not uncommon for us to have clients who have some dental issues to spend, $10,000 to $20,000 on their dental work.
Okay.
And so you've got to be, if there's anything you're going to do prior to retiring, make sure your eyes, if you've got anything going on with your eyesight, because you don't have vision and you don't have dental when you're under those Medicare supplements.
I wish I would have known that. Alex's grandma has such bad problems with both, and she is past Medicare age. Grandma, we got to get your eyes and your teeth.
Yeah, that's right. See, we should put that in like a checklist, right?
Yes.
Like,
eyes, teeth.
Yeah, absolutely. Yeah.
Sign up for 401k.
Yeah. Well,